Because for years I was afraid to admit that I was crazy, not knowing that I was the only one amongst a sea of many to finally have the courage to admit to it. And for that, I thank you. But I do pray that if this is your story, that you never have to become as deep as me. Ashe.
So this is your last chance to get your wonderful lines in. If you haven't already, if you have, you can always write more than one. After that, though, they'll be putting it all together for us. So I'm going to pass this right now. Pass this. Okay, so the next section that we're in right now is actually, again, looking at our lovely partners with this. I think that a lot of people don't realize the great work that's already being done in DC with HIV, with AIDS, with so many health disparities that's going on in DC. And so we partnered with two great organizations, and I really suggest for you all to Google them. They are Googleable, our word for the night, and really participate in them, really support them, because it's events like this that, you know, we go to, but we have to really make sure that we do something afterwards. It's great to hear the poetry, it's great to, you know and understand what's going on, but it's even better if we can actually make a movement from this, or, you know, if someone gets funding because of these types of situations, these types of events. So I'm going to first bring up our Choice USA representative, Ms. Kiera. She's going to tell you some things about Choice USA. So bring her on up. Bring her on up. Come on. Don't dive in.
Hi, everyone. I'll keep this short and sweet. Choice USA. Am I good? Yeah. Okay. Choice USA is based here in DC, and our whole mission is to develop the next generation of sexual and reproductive health advocates. The reason that I'm here today, and thanks to the National Black Women's Health Project, and I have a crush on Metro Teen AIDS, I just had to say that. The reason that I'm here tonight is because young people are truly under attack right now in this country. You've probably heard these statistics before, but a report came out last year that 1 in 4 young people between the ages of 13 and 19 will contract a sexually transmitted infection. 1 in 4. When you're talking about Black young people, it's 1 in 2. Young folks under the age of 34, so between 13 and 34, accounted for over 34% of the HIV cases in 2007. In Utah right now, there's legislation that says that young people, particularly young women, girls and women, could be prosecuted if they have miscarriages. Abstinence only until marriage education that is fear-based and does such a disservice to our young Black kids, and particularly those who identify as gay, lesbian, bisexual, and trans. It gets millions and millions of dollars of funding. And so I'm here because bringing together folks, in DC, across the nation, to stand up for young people is what the work is all about. There are postcards actually on your tables right now that are, I'm hoping you will all sign to get comprehensive sex education in this country funded for the very first time. And so if you would be willing to sign those and just leave them on the table, we'll pick them up. We would really appreciate it. I thank you all. I do this for young people. I'm going to be a new mom in August, so I do that for my child who will be here soon too. So again, thank you for inviting me, and thank you for being here.
All right. So now we're going to bring up Metro Teen AIDS, who is doing some great work with the teenagers in the area. So let's give a hand.
I'm the Director of Community Outreach and Partnerships at Metro Teen AIDS, and one of our partnerships is with the Black Women's Health and Parenting, and be here tonight to support you all's work. It is really exciting for us to take part in this because oftentimes we're not able to access older young women in the district. Metro Teen AIDS has been around for 20 years, and we work with young people between the ages of 13 and 24 to address issues of HIV and AIDS and prevention. But also to educate young people in the community and Michelle that was up here earlier, and there were a few other peer educators in here tonight. They go out all across the city educating their peers about prevention, other sexual health needs, and addressing the disparities that our young people experience in their lives that put them at risk. And for us, and particularly for myself, partnerships are the thing that really move our work forward. We can't do this work in isolation. This is community space here, there's sisterhood here, community connection in this space, and as a provider in the city, what's imperative is that we continue to go beyond what we look to as our traditional places of operating with each other and ways in which we talk about not just disease, but community dysfunction or lack, and operate from a place of asset together in a collective fashion. So how can I contribute to your space? How can I contribute to you as an individual? And we work to implement those things in the experiences in the lives of our young people. So it's a pleasure to be here to support the work. We had representatives at our event this weekend that was in collaboration with the National Council of Negro Women. And so it's really exciting to see our work going beyond the doors of our agencies and coming into spaces where we know people are congregating and having a good time. I love Tabak. I was like, it's gonna be a Tabak. But it's taking our work, our conversation about women's sexual health, our conversations about protecting each other and loving each other to a whole new level and experiencing ourselves in a different way as providers that are also a part of the community. So thank you very much.
Big mega mix with Madam DJ Soyo, and this is when our poets are actually going to be putting your words and your lines together in a poem created right here, right now. Your lines, if you look and turn around and see them, they're talking it out right now, so you get to see the actual artistic process as we spin off right now.
This y'all stuff. This y'all prepared. Okay. Don't let lust choose for you. Say no to HIV. AIDS is your choice, not your destiny. Ladies, flip the script. Tell them, baby, if you want me, wear it. Need me, wear it. Trust me, wear it. Love me, wear it. And if he's still not feeling it, want yourself, trust yourself, love yourself. Don't let it pass your mind, and don't leave. It's supposed to be left. Oh, don't leave it
be.
Oh, leave it be?
Yeah, leave it be.
Okay. Don't let it pass your mind and leave it be. And leave it be. This some real shit, y'all. It's called HIV. Cool.
Empowerment decisions. Empowerment decisions.
Like
Healthy women. Oh, empowered.
See, we gotta help each other.
Empowered decisions. Healthy women. Healthy lives. That's why I bring Real Talk to DC. My spirit has been exhausted by HIV. It's time for rejuvenation. If I had waited opposed to following the in crowd, maybe I would be able to have a long future.
As long as we are silent about HIV, it will continue to be a silent killer. Let's break the silence. It's killing us.
We will overcome HIV with the spirit of love. We will overcome HIV with the spirit of oneness.
HIV shall not and will not stop our community. We will progress.
Your choice is your future.
Protect yourself. Protect our future.
AIDS is a sad reality, but together we can make it. We can make history.
We must do what it takes to save our children now.
Act like you love life.
Live to love. Don't die from love.
I am red too. We are all red because HIV affects us all.
Sean J.
Wonderful. Even though I'm very loud, I like mics. Shut up, Joseph. Okay, so we are going to put all of this together, and it's actually going to become a commemorative poem for the first year that we have done this. And so this will be online with the Black Women's Health